Hi, I'm Dr. Sakarya. Today I'm going to talk about facial palsy or paralysis surgery. Facial paralysis is the lack of facial muscle movement because of various reasons. These reasons can be post-surgical complications, birth deformities, congenital reasons, Bell's palsy, or tumors. Facial palsy can cause a lot of problems in the face, especially aesthetic problems, but sometimes functional problems such as problems in the eye closure causing a lot of corneal irritations or lack of eating or speaking. Facial paralysis can be permanent or temporary depending on the reason, and also incomplete, for example just affecting the eyelids or affecting the mouth or the full face. Many people think that facial paralysis is untreatable. However, there has been a lot of advances in the recent years, and we can do a lot of treatments for facial palsy patients. First of all, treatments depend on the cause and the extent of the involvement. For example, just for forehead palsy paralysis, we can do only a brow lift. For eyelid palsy, we can do a nerve transfer, a gold implant placement. For facial palsy affecting smiling and causing asymmetric smiling, we can do again nerve transfers, muscle transplants, and some cases we can just do Botox to establish symmetric smile. Nerve transfers include the donor nerves of biting muscles, tongue muscles, or sometimes from the other side, the healthy side, nerve transfers. And muscle transplant generally is the transplant of the inner thigh muscle, so-called gracilis muscle transfer. And sometimes we can prefer some local muscle transfers, for example, temporal muscle transfer or masseteric muscle transfers for better smiling. Another important entity is facial synkinesis. In these type of patients, we need to combine all treatment options, including Botox, nerve transfers, muscle transfers, and sometimes muscle resections that are working too much. I'm a plastic reconstructive aesthetic surgeon specialized in peripheral nerve surgery and microsurgery and facial aesthetic surgery, and completed my fellowship in Taiwan under Fu Chan Wei and David Chuang, who was one of the pioneers in the reconstructive microsurgery and facial palsy field. And I have been doing reconstructive microsurgery for more than 10 years. I'd like to share one of my patients' story with you. This girl was operated a few years ago at the age of 10 elsewhere and had a muscle transplant with cross-face nerve transfer. Unfortunately, it didn't work, and I had to operate her and remove the whole muscle out and do a new nerve transfer from the shoulder nerve and do another muscle transplant to establish her smile.
Facial paralysis is always permanent.
No, it's not always permanent. However, there are some type of facial palsy that is always permanent. But still treatment is possible. We can do muscle transplant, nerve transplant, or other treatment options.
If you don't recover in 6 months, there is nothing you can do about it.
No, it's false. However, if there is more than 6 months since the start of the facial palsy, it's high likely to be permanent. That's why immediate intervention is generally needed after 6 months of facial palsy.
Facial palsy can only fix with one surgery.
No, it's generally wrong. We generally need more than one surgery, not just to fix the facial palsy, but also to make it more natural, more symmetric, and more beautiful. We may need a couple of surgeries. But generally, the main surgery is the biggest one, but the other surgeries are just small type of corrections and touch-ups. And facial palsy can be devastating. However, we have many tools, so please feel free to consult your condition.